Hi folks, it's Marvin Musick with MedicareSchool.com, and we want to welcome you to Medicare Monday, where we have one primary goal in mind every Medicare Monday, and that is to share with you things that are really critical for you to know. And I begin this program live stream oftentimes with this question, that is this: do you have to know everything about Medicare in order to make good Medicare decisions? And the answer to that is no, you don't. But do you need to know some things about Medicare in order to make good Medicare decisions? And that answer is absolutely yes, you do. The problem is sometimes people don't know exactly what they need to know, or they don't know what they don't know. And so it can be very confusing. It can really bring a lot of consternation and a lot of anxiety with many people because there's just so much information, very overwhelming. You'll have a lot of different opinions about what you should do. And so really the goal of Medicare Monday is to make sure that we can kind of set aside the things that are unimportant, but really focus on the things that are going to matter, because there are some things that really do matter and you need to understand those. And so that's really what I'm going to discuss tonight. We titled this Everything I'd Want Someone to Tell Me or Share with Me as I make a decision whether that's going to be an Advantage plan or a supplemental plan. And so, by the way, I'm not on Medicare yet. I am approaching 62, so I still have about 3 years to go. But if I were going on Medicare, these are the things that I would want someone to share with me. And so I hope these things will be helpful for you. Our whole goal as a company is to make sure that people, number one, are not pressured into making decisions that they don't fully understand. We want to make sure that you really understand all your options, because when you make these decisions, sometimes they're lifelong and they're certainly going to have consequences. And so we want to make sure that you understand how Medicare works and what your insurance options are going to look like, because frankly, you really don't know how good your insurance is until you need to use it. All right, so let's dive in to the subject tonight and talk about what I would want to know if I were going on Medicare right now. So first off, I'm going to make a contrast. I think it's a great way to teach, to make a comparison. And so the two systems available to us, whether that's an Advantage plan or it's a supplemental plan, are totally different, folks, totally different, except one item. When you make the decision to go on Medicare, which means you're approaching 65 or you're getting ready to retire and maybe you're 67 or 69 and you're ready to come into Medicare, regardless of the choice that you make about an Advantage plan or a supplemental plan, you have to be enrolled in Medicare A and B. Okay, you have to be. And so you do not, you're not eligible for either an Advantage or supplemental plan unless you get enrolled in Medicare A and B. And so I want to just briefly hit on that, and then we're going to make the contrast between these two insurance options. So first off, there are a group of you that are watching this tonight that you need to understand that you have to go on Medicare at 65. And there's actually four types of people, situations where you're required to go on Medicare. And that means this: if you are covered by a retiree plan or you're covered by your spouse's retiree plan, you have to go on Medicare at 65. If you're presently covered by you or your spouse's COBRA insurance, you have to go on Medicare at 65. If you're covered by an Affordable Care Act plan, which means you went through the healthcare exchange to get an individual plan through that government-sponsored program, you have to go on Medicare at 65. Or if you're in what is called a small group plan, which means there's 19 people on the payroll or less at your company and you're covered by that insurance plan, then again, you're going to have to go on Medicare at 65. All right, so again, people on retiree plans, COBRA plans, ACE plans, 19 or fewer that are on the payroll at your company, you have to go on Medicare. You've got enrolled in Medicare to put Medicare in the first payer position. Now, if you're on Social Security, and that's you're going to be automatically enrolled into Medicare, and your Medicare card is going to show up in the mail about 100 days prior to your birth month. But if you're not on Social Security, you have to initiate the enrollment. You will not be automatically enrolled. You have to enroll, and you must enroll during what is called your initial enrollment period. The acronym is IEP, and the IEP lasts 7 months. And so if we have to start at 65, we got to make that decision during that 7-month window. And the month that you enroll during that 7 months will determine when your Medicare benefits are going to begin. So you need to enroll at the right time. If you need to start at 65, then you should enroll 3 months prior. Today is August the 15th. If you turned 65 today, August the 15th, 1957, you would have had 3 months before this month, the month of your birth month, and then 3 months after to enroll in Medicare. And the month that you select will determine when they start your coverage. And my whole point is this. If we're going to choose a supplemental plan or an advantage plan, we have to be enrolled in Medicare. And so if you're coming in at 65, you're either automatically enrolled or you have to self-enroll. Now, if you're not going to go on Medicare at 65, there's only one reason why you don't have to, and that is if you or your spouse are covered by an employer-provided plan, there's 20 or more people on the payroll that's in the company, you do not have to go on Medicare, A or B. You can stay on the group plan, and if that group plan is better than your Medicare option, it is fine to keep that coverage. And then when you lose that coverage, either retirement or you decide you no longer want it, then you'll be eligible to come into Medicare using what's called the special enrollment period. And if I were going on Medicare, I'd want someone to make sure they help me to know when is the right time to come on Medicare. There are some people who start Medicare too late, they're penalized, or some people start Medicare, frankly, too early. They had a good group option and they went on Medicare anyways. Others of you, you don't have a good group option. You have a group plan available, but your group plan is expensive out of pocket. And so what you should do is compare your Medicare option with the group plan, and sometimes Medicare will make sense while you're still working. Sometimes not, but you got to make that comparison. Okay, so that's the given. What do they have in common? Subs and advantage. You have to be enrolled in Medicare A and B to have either one of those. Now let's look at the contrast. First off, I want to talk about how the coverage itself. In other words, the coverage of the way this insurance is going to work is going to be different. All right, so first off, they work differently in this way. If you decide to go with the supplemental plan, you certainly are enrolled in A and B, as I just said. And what's going to happen with that supplemental plan is that supplemental plan is going to fill in the gaps that exist in Medicare. I'll tell you about those gaps in just a minute. But big picture is I'm enrolled in A and B pays first, but there will always be gaps remaining, some financial liability, some financial responsibility that you have. We call those gaps in your coverage. And so we get a supplemental plan to fill in those gaps, either fully or almost fully. And so in that Medicare A and B system, it means that Medicare is going to set all the rules for what's going to be covered and not covered. Medicare actually sets the rules on the supplemental plans based upon what they're going to cover and not cover. And so when we get a supplemental plan, we're following Medicare. So if Medicare pays, the supplemental plan has to pay based upon the letter that you buy. That's how that system works. If we have a claim problem, we go directly to Medicare. Why? Medicare is the one that processes those claims. So what happens when you're in this Medicare supplemental system, when you go to the doctor, you're going to give them two cards. You're going to give them your A and B Medicare card, and you're also going to give them your supplemental card, whatever one you buy. And the provider files the claims. You never have to file a claim. They'll file the claim. It goes first to Medicare. Medicare, of course, does its discounting and then pays their part and then takes the balance of that service, whether it's in the hospital or to a doctor or a test or whatever it is. They take the balance, of that service, and they send that over to the supplemental company that is going to pay the terms that that supplemental plan has to pay, depending on what you buy, and I'll explain those in a few minutes. But Medicare pays first, supplemental plan is going to pay second based upon the plan that you purchased. So in that system, if we have a problem, we're going to Medicare. Medicare is setting the rules. That Med Sup company is just simply following, paying the gaps based upon the plan that you buy. Now, also in that system, when it comes to prescription drug coverage, in other words, these are the medications that you personally administer. Because remember, Medicare A and B will pay for some prescriptions, but those are inpatient and outpatient prescriptions that are professionally administered. Okay, Medicare A and B will pay for those. But meds that you're taking on your own, your diabetes medication, or maybe your heart medication, or cholesterol, high blood pressure, those meds that you self-administer, when we have a supplemental plan, we have a separate prescription drug plan. I would want to know that. Why? Because I know in that system, I can pick and choose what plan I want. In most areas, there's going to be anywhere from 15 to 25 different drug plans to choose from. And we choose a plan based upon the medications that we take and the pharmacy that we would like to go to. We find the most cost-effective way to get our medications covered. But in that supplemental system where I have A and B in a supplemental plan, I have a separate drug plan. That's called a standalone drug plan. Many times it's a separate company, and there's a separate premium that we will pay for that drug plan. Those range anywhere from less than $10 upwards. Average probably is $25 or $30. There's some that are higher than that most people don't need, but we have a separate premium. So in that system, it is what I would say just simply a pure insurance system. Medicare pays first, supplemental plan pays second based upon the supplemental plan that you buy, and we have a separate drug plan. So it's going to be a system where the government is primarily making all the rules for what's covered and what's not covered. All right, that's how that coverage works. Now, we contrast that to Advantage plans. It's a totally different system. Remember, the only thing they have in common is you got to pay your Part B premium. This year, that's $170.10 a month. So whether I have Sup or Advantage, I'm enrolled in A and B. So in that system, now what we have is we have a private health insurance company that is replacing my original Medicare benefits. And what's really happening behind the scenes is that Advantage plan looks at original Medicare A and B, and they're going to repackage the A and B benefits and reprice them and put together a provider network. And so it's a private health insurance company. Now, again, we're still enrolled in A and B, but in that system, what's happening is you take your A and B card and you put it in storage because you're not going to use that. Because now when I go to the doctor or I go to the hospital, I'm going to pull out one card. It's my insurance card that covers me for inpatient and outpatient and prescription drugs. I have one card. And so when I go to a provider to get a healthcare service, I give them my card. I will have a copay for the majority of services. There's a few items that don't have a copay, but most of them are going to have a copay. And I pay a copay, and I'll share those with you here in a couple minutes. But we have the copay. And then the balance of that bill is then sent to the private health insurance company. And now they're responsible for the balance of that bill. And so many people say, well, why would a private health insurance company do that? Why would they now be responsible after I've made a very reasonable copay? Well, the reason is because when you enroll into an Advantage plan and you get that replacement plan, what happens, Medicare, instead of paying individual bills like they would with the supplemental plan, takes a monthly amount, a monthly fee. It's about $1,000 a month, that range. And they take the $1,000 out of the Medicare budget and they send that to the private health insurance Advantage company. And they have agreed that now this Advantage company, private health insurance company, is now responsible for you less your copay. So they give them $1,000 a month. Now, some of you, they would make a lot of money off of you. Others, they're not going to. But the rules are this: as they get this $1,000 a month on your behalf that goes into the insurance company's coffers, they have to spend 85 cents of every dollar on someone's care that's in the group. So that private health insurance company now frankly exists to take care of you, of course, but also to make a profit margin. That's which is fine by me. All companies should make a profit. That's how we grow our businesses, and that's how we get to pay our employees. But now we have a private health insurance company that's involved in that Medicare, the Medicare decisions. They're going to put together a network of physicians and other rules that they're going to attach to that, because that's how the private health insurance company is going to make sure that they're profitable by putting together a different type of system that's now going to cover you for your health care costs. Now, when it comes to prescription drugs, we said with the supplemental, we have maybe 15 or 25 separate drug plans to choose from. When I have an Advantage plan, they include that as part of my coverage. It's embedded within the plan. So you don't really pick and choose what drug plan you want. The insurance company chooses that plan and embeds it. And frankly, sometimes they're very good and sometimes they're just average, but it's part of the package. And again, I'm telling you the differences between these. So if I was going on Medicare, I'd want to know, well, can I pick and choose what drug plan I want, or do I have to take what they offer me? And yes, if I have an Advantage plan, I take what they give me. And again, it could be very good, but we want to make sure that we're very happy with the copays and the different aspects of the formulary that will be within that Advantage plan prescription drug component. Okay, and so that is number one. That would be the coverage. It is really different. A government insurance versus a private health insurance option. Okay, so that's coverage. Now I want to talk about the cost involved, because your out-of-pocket costs are, again, going to be totally different in that system. So again, let's talk about the supplemental plan first. Obviously, I have to be enrolled in A and B. A is free for most people. B has a premium. Now, if you're single and your income is $82,000 or less, or you're married and it's, that's $91,000 or less, a married couple $182,000 or less, it's called your modified adjusted gross income. So let me repeat it. So if I'm single, $91,000 or less, married $182,000 or less, we pay $170.10 a month for our Part B premium. That is going to come out of your Social Security check if you're receiving benefits. If you're not, they will bill you for that quarterly, or they will allow you to pay through a monthly bank draft through what's called Medicare Easy Pay, or if you have a mymedicare.gov account, you can go online and you can pay your premiums that way. But we're all paying for our Part B premium. Okay, so that gives us those Part B benefits. So that's one of the costs we have. A is usually zero. B is $170.10 for about 90% of the population. Now, if you're a single person above $91,000 or a couple that's above $182,000, you will pay more for your Part B premium. Those additional amounts are called IRMAs. I'm not going to get into a lot of details of that right now, other than to say that if you're higher income based upon Medicare standards, you will pay more for your Part B. That's going to range anywhere from about $70 or $80 a month upwards to maybe $400 a month in surcharges called IRMAs. Okay, and so it will cost you more because of your income. All right, and so when we talk about the cost of a supplemental plan, now we're going to have to realize that within the original Medicare A and B system, we have gaps that exist. These are financial liabilities that you will assume. You're responsible for them, and there are 6 of them. And so I want to make sure, hopefully you're taking notes, you'll understand these. So again, these are things that Medicare pays first, but I'm going to have a balanced bill that's going to remain. These are my liabilities, my financial exposure. We call them gaps. So on the A of Medicare, there are 3 gaps, and on the B of Medicare, there are 3 gaps. And so the gaps on the Medicare A are a deductible. If I go to the hospital, it will cost you $1,556 in the form of a deductible. Now that deductible is unique. It's not annual. It's tied to what Medicare calls a benefit period. Now a benefit period works this way. When I'm admitted to the hospital, I start a benefit period. And let's just say I am discharged 7 days later. So I was in the hospital a week. And then I go home. So they discharge me 7 days later. From the day I'm discharged for the next 60 days, I am still in my benefit period, which means during that 60 days of being discharged, if I have to go back to the hospital, I'm still under the same deductible. I'm still in my same benefit period. Very easy. But let's suppose I go to the hospital, 7 days later I go home, and 60 days goes by and I'm not rehospitalized, but I'm rehospitalized after those 60 days. And I have to go back to the hospital. I will owe another deductible, $1,556 this year, and I will start a new benefit period. All right, so that deductible is my only out-of-pocket expense for up to a 60-day stay in the hospital. I mean 60 continuous days. Now, folks, that's a long time in the hospital. Okay, most people are not in that long. Right now, I think the average is like 5.5 days. Okay, so 60 days is a long time. But if I happen to be in the hospital 60 continuous days and then I'm still in, so once I get in now the 3rd month, Medicare begins to charge daily copays. So this would be month 3. It's going to cost me every day while I'm in the hospital during month 3, $389 a day. If I'm in the hospital after month 3, I'm in month 4 and month 5, they double the copay. Now it costs me $778 $778 every day to be in the hospital month 4 and month 5. Again, those situations are very rare, but when they occur, they are very expensive, and that would be your out-of-pocket responsibility. And so we call those extended hospital copays. Again, that's after 60 days. First 60 days, you spent $1,556, but after that, it gets rather expensive. Now, the last item where you have a gap on the A of Medicare is called skilled nursing facility. So this is someone that's had a stroke or maybe a knee replacement, not a knee, a hip replacement. Knee replacements are outpatient, but hip replacements. They went to the hospital, they had hip replacement, they had a stroke, maybe they were involved in an accident or a fall or an injury, and they need to go to a skilled nursing facility for fairly intensive rehab. Medicare A is going to cover the skilled nursing facility as long as that person was in the hospital at least 3 full days prior to being admitted to skilled nursing. That's a requirement the government has. It must be in 72 hours. They call it 3 midnights or longer. And then you can leave the hospital, go to skilled nursing, and Medicare covers everything the first 20 days. It doesn't cost you a penny. Now, if you're not in the hospital 3 days or longer, they're not going to pay anything. But if we had that hospital stay of 3 days or longer, now they cover everything the first 20 days. If I'm still in need of skilled nursing care after 20 days, Medicare gives me 80 more days of eligibility, but now I'm responsible for a daily copay. That daily copay right now is $194.50 a day. They tell me the average Medicare recipient is in skilled nursing somewhere between 30 to 35 days, right? So the first 20 was on Medicare, so the next 10 to 15 days is going to be on you. So it's about $2,000 to $3,000 that the average person is spending out of pocket in a skilled nursing facility in original Medicare. So those are the 3 gaps on Medicare A: a deductible, extended hospital copays, and extended skilled nursing copays. Now let's talk about the B of Medicare. Now the B of Medicare is everything outpatient related and all doctor services. So it is the B of Medicare that always pays your doctors, whether that's a doctor that you go to see in their office or that's a doctor that comes to see you in the hospital, which would include hospitalists or emergency room doctors or surgeons or anesthesiologists. Any kind of a doctor that treats you, whether in or outpatient, will be paid through the B of Medicare. Part B of Medicare also pays for durable medical equipment. All right, so that's the difference between A and B. A is pretty much everything inpatient. B is everything that's going to be outpatient plus doctor services. So financially, your gaps are these. We have a deductible this year on the B of Medicare that's $233. It is not that crazy deductible like we have on A. It does not happen multiple times a year. It happens just once a year, and it's a calendar year deductible. So today is August the 15th, 2022. So if I start Medicare September 1, that $233 is my deductible for this year. They're not going to prorate that. It's very small, it's very reasonable, but you're responsible for the first $233 of anything that would be outpatient or doctor related. And once we've met that small deductible on the B of Medicare, that takes us to our second gap, which is called coinsurance. So on the B of Medicare, it is an 80-20 plan. So Medicare says they're going to cover something. Medicare is going to pay 80% of that bill, and the 20% is your responsibility, called coinsurance. Now, what you have to do, and we tell all of our clients this, you want to make sure that Medicare is going to pay. It's simple to do. We only ask 2 questions when we stay in this system of A and B with the supplemental plan. We ask every provider, do you take Medicare? Find out. Most do, but you still need to find out. If they take original Medicare and you're seeing them through a primary care visit or maybe a specialist visit, you're going to ask them if they're recommending anything beyond the office visit. It could be labs, it could be a test, it could be a clinical trial study, it could be some kind of a procedure, maybe a surgery. You always ask that provider, is Medicare going to cover this? And so when we're seeing a Medicare provider and the service is covered by Medicare, and we're talking about the B side of Medicare now, it's 80-20. Medicare pays 80% of the bill, and you're responsible for 20% of the bill, called coinsurance. And frankly, this coinsurance is really your biggest liability in Medicare. Why? Because that 20% never stops. Never stops. There's no stop-loss limit. Now, we can buy insurance to stop it, but if you don't have any insurance, that 20% is always on you. And the problem is, if you have a serious health issue, every doctor you see, you got to pay 20%. Have a surgery, guarantee the surgeon will be there, of course, anesthesiologists in the room and maybe other physicians in the room, but every physician that's part of that surgery or that health illness that you're going through, you're going to be responsible for 20%, and there's no limit to that. All right, really, it's the biggest risk in Medicare today. And then lastly, we have a thing called excess charge. And so this is when a physician takes Medicare patients, files claims with Medicare, and is just a normal Medicare doctor, but this is a physician that doesn't agree under a contract to take Medicare-approved reimbursement amounts. A doctor that does take Medicare reimbursement amounts is called an assignment doctor or a participating doctor. That's 90% of doctors do that. But 10% do not participate, or they don't take assignment, and they add 15% to the bill. And when they add 15% to the bill, you're responsible to pay for that, hence the third gap on Medicare B. Small deductible, $233, 20% coinsurance, that's unlimited, and the possibility of seeing a physician that adds to the bill. So those are the 6 gaps in the Medicare system. So those are your financial liabilities, your exposure, and so what you can do in that system is is you can take those gaps, those liabilities, and you can transfer those to an insurance company. And for these folks, that's all we do when we get any insurance. If I wreck my car, I don't want to have to pay for the repairs, especially if I cause the accident. Other people's cars and maybe even injuries, I'd be responsible for. I don't like that, so I can buy a auto policy, and I can transfer that liability to an insurance company. I pay them a premium, and they take that liability from me. Same thing with homeowners insurance. If my home burns down, I hope it doesn't, but if it does, I don't have to rebuild it. Why? I transferred the risk of that to my homeowner's policy. I pay them a premium, and they take care of that. So in original Medicare, we have these health risks, these gaps that we're responsible for. So you can transfer all the gaps away, or most of the gaps away, and when we do that, we're going to have to pay that insurance company a premium. Again, I'm talking about the cost now of going with the supplemental plan. Now, our live stream is all over the country, so I'm just going to give you some ranges. Okay, now there are 10 supplemental plans available. Each of those is going to have a different monthly premium. I'm not going to get into every one of them. They're all available for sure, but I can tell you that probably 95 to maybe 97% of all people today that get supplemental plans are buying one of three plans: an F plan, a G plan, or an N plan. Now, again, they have different letters, so we have different coverage amounts, different liabilities, different amounts that you're transferring, and a different amount that you retain. So if you get the F plan, it's truly a full coverage plan. You can transfer all 6 gaps to the insurance company. You pay them a premium to take that, and literally, if you're on an F plan, you should really never get a bill, because if Medicare pays any gap that remains, any of the 6, that F plan is going to pay those gaps, so you should not get a bill. Now, of course, that's the highest premium because it's the highest amount of coverage. Now, the one below that is called a G plan. The G plan is the plan, again, a different letter, and it covers 5 of the 6 gaps. And the gap the G plan doesn't cover is the Medicare B deductible. And that B deductible this year is $233. Remember, I told you it's annual, calendar year, so it resets every January. So a person that has a G plan will be responsible for that B deductible on an annual basis. So once they've met it, they have 100% coverage because the G fills in 5 of the 6 gaps, all but the B deductible. And then lastly, the N plan, another good plan. Now again, it's a different letter. We're going to have a lower premium than the F and the G with the N plan, but we're also going to take on a little bit more liability. And again, you have to decide what you're comfortable with. But with the N plan, our gaps are, we're responsible for the B deductible, like the G, $233. And then if you happen to go to a doctor that charges excess, remember they add the 15%, the N plan will not pay that for you. F pays it, G pays it, but N does not. So anyone that has an N plan is saying, I'll be responsible for excess if and when it ever occurs. Frankly, not a lot of risk, but that's today. That could change in 5 or 10 years. We don't know. And then anytime that you go to a physician, you go to a doctor, you'd be subject to up to a $20 copay. If you go to the emergency room, you'll pay a $50 copay. So again, we have a lower monthly premium, but we're taking on a little bit more liability. And there is no right or wrong or best or anything. It's just a matter of what you're comfortable with. All right. So those are the top plans. So what are those plans doing? They're filling in the gaps based upon the letter that we purchase. And again, this is all over the country, so I'm just going to give you some ranges. Okay, so first off, the F plans right now are ranging anywhere from about $150 to $160 upwards to maybe $200 on a monthly basis. Your G plans are going to be in the range of about $125 to maybe $150 a month. And then your N plans are going to be anywhere from about $90 to maybe $125. Okay, so let me say it again. N plans, 90 to about 125, G plans 125 to maybe 155 range, and your F plans are going to be about 155, 160, upwards to $200 a month, depending upon where you live and your age. Okay, and so those are going to be the cost with the supplemental plan. Now remember, when I go in that system, I'm going to add a drug plan to that coverage. Could be a separate company, it will be a separate policy, a different company, and you'll have a different premium for that. And again, those are going to range anywhere from $7 to average probably $25 or $30 a month. If you're taking 15 meds a day, you'll probably be on a higher cost plan, but I think the average is about $25 to $30. And so that's the cost. Now, when it comes to out-of-pocket costs beyond the premiums on the F, the G, and the N plan, then we have very little out-of-pocket cost other than those gaps that remain that we are responsible for. Now, a couple clarifications. If you want an app plan, you do have to be born before January 1st, 1955 to qualify to get an app plan. And so that's the rules. You had to be eligible for Medicare prior to January 1, 2020, which means you were born before January 1st, 1955. Anyone who is that age group will be able to get an app plan and keep an app plan their whole life. Anyone born after January 1st, 1955 cannot get an app plan. You can get a G or an N plan. All right, so those really are your decisions. So that's the cost. Now, let's talk about Advantage plans. With those, again, we're enrolled in A and B. We pay our B premium, $170.10 a month. But now, instead of paying a premium, what happens is we're going to pay copays. In most markets today, we're going to have about, probably 30 different Advantage plans to choose from. And so half of those are going to have a zero premium. There's no cost that the insurance company is going to charge you. Remember, they're getting paid by Medicare. Now, there are a few of them that are going to have a small premium. Usually it's because they embed a very broad prescription drug plan. That's typically what's happening. So you're going to have a better drug plan, so they may charge a small premium. But again, they're very low or very no premium. Why is that? Because we're going to pay as we go. And that's a pay-as-we-go system. So with supplemental plans, it's pretty much premium-based. Advantage plans are pay-as-we-go. Now, you need to know that there are a few items that will be zero on your Advantage plan, no copay. You can almost always see your primary care doctor at a zero copay. The drug plan they embed is also a zero premium for that. Preventive, it certainly would be zero. So there'll be a few items that will be zero in the Advantage plan. But the majority of services, you go to the hospital, you see a specialist, you have a CAT scan or an MRI or an outpatient procedure, you're going to have a copay. Now the good news is those copays are very reasonable. And so if I go to the hospital, it may cost me $350 a day for the first 5 days, zero after that, each hospitalization. I have a specialist visit, probably cost me $50. I have cataract surgery, maybe $250 to $300 per eye. I have an outpatient procedure, about the same. If I want an MRI or a CAT scan, it may cost me $200, $250. But again, they're very reasonable copays. So what am I doing? I'm paying as we go. And all those copays are going towards what is called the max out of pocket. And basically, once you reach your max out of pocket, you put your wallet away, the company will pay 100%. Now, those max out of pockets are going to vary from plan to plan and region to region. But on the average, they're going to be somewhere between about $3,500 to about $7,000 out of pocket. And then you'll also have a benefit that would be out of network. And so if you go out of your network, if that's an option for you, such as a PPO plan, then you may be upwards to $10,000 out of pocket. But my whole point is the cost of an Advantage plan is you simply just pay as you go based upon the service that you receive and the copay that's attached to that service. But eventually those copays will stop. And then what happens is every year those copays are going to, those max out of pockets will reset. So if my max out of pocket this year is $6,500, if I reach $6,500, I'm done. And then in January, again, those are going to reset. I got to start paying copays again until I hit my max out of pocket. So again, we're talking about the costs. So no premium or very low premium other than the Medicare, but now I'm going to pay as I go until I hit my max out of pocket. All right, so the costs are going to be different. Now, I want to talk about the choices that are going to be within this system. If you get a supplemental plan, I already told you the most popular plans F, G, or N, but you have a variety of companies, lots of companies, UnitedHealthcare, Aetna, Humana, Mutual of Omaha, lots of companies out there that are going to offer plans. Okay, now, when it comes to you buying a G plan, the coverage will always be the same. If you buy a G plan or an N plan or an F plan, the coverage will be the same regardless of the company that you choose. And the reason for that is they're standardized by Medicare. So Medicare says to you, if you buy an F plan, as long as Medicare pays first, that F plan will fill in all the gaps. So it doesn't matter if you buy it from ABC Insurance Company or XYZ Insurance Company, the coverage is the same. The same bills will be paid, the same amount of bills, and the same type of bills will be paid the same. Why? Because Medicare makes it that way. If I buy a G plan, no matter who you buy it from, as far as the coverage is concerned, you're going to meet your B deductible, and we have 100% coverage after that. Now beyond that, coverage, there will be differences. Certainly the companies are going to have different premiums. Some are more reasonable, more stable than others, but that's going to vary. The ratings of the company can vary. There's a lot of things that can vary from carrier to carrier, but as far as the coverage is concerned, they're going to be all the same. So we would never say, let's go with this carrier because they're going to pay better than another carrier. Folks, that is not true at all. They're all going to pay the same bills. So we can make comparisons, and I'll share that in just a minute. But as far as coverage is concerned, that's all the same. So we have lots of companies to choose from. And so you need to compare those plans. Now, what is going to matter to you when you look at these different choices is two things. You want to look at the initial premium that is being offered, as well as the stability of the rates that the company has had for the last 10 years. Many people just buy the cheapest that's available, and that may not be the best, because what happens is all plans are going to go up in price. Now, most places go up as we age a little bit, but the plans can have group increases, and a group increase occurs whenever the plan you're in is losing money. So what happens in every supplemental plan is you have a group, we call it a block of business. Money goes in through the premiums paid by the policyholders, and money goes out as the company pays claims to providers. So when more money goes out than is coming in, that company is losing money, that block is losing, and then they can ask for a group increase. They have to get it approved by the insurance commissioner of the state, but if it gets approved, then everybody in the group goes up. And so what happens is we have this risk that if I'm in a smaller group, I may see more price increases frequently and more drastically. If I'm in a larger group, then I'm probably going to have more stable rates. My point is this: don't just look at the initial premium. Let's see the history of how often these companies raise their rates, how drastically, and how frequently. Why? Because if you get in a small group that has a lot of health problems, you're going to feel the pain of that, because those rates are going to go up more drastically and more frequently. If we get in a large group, we're probably going to have more stable rates. I'll give you just a simple illustration. If you're out in the ocean and you're just in a small canoe, I can assure you, you are going to feel every wave that hits that canoe. It's going to be a pretty rocky and rough ride, right? Big ocean, small boat. But if I'm in that same ocean, I'm in a cruise ship, much larger, sometimes you don't even feel like you're even in the ocean. You're not going to feel the impact of all those waves. And so if I get in a small insurance group and that has a lot of health problems, you're going to feel the impact of that financially. Rates are going to go up more frequently, more drastically. But if you're in a large group company, you won't feel as much of the pain. All right. And so the point is, you got to care about stability of rates. So anyone who really cares about you is going to take the time to show you how these companies have performed in the last 5 or 10 years. And normally history repeats itself. So you want to go with a company that has larger block, because the results should be more stable rates. And some companies will lowball. They'll just simply give low rates knowing that they're going to inch those rates up over time. Okay, so that's what matters on a supplemental plan as you look at the choices. Now, when it comes to Advantage plans, again, you're going to have choices, lots of them. But basically, it's going to boil down between two types of networks, either an HMO network or a PPO network. So if you decide to go with an Advantage plan, you have to understand the restrictions of the networks. Now, you'll find that HMO networks are going to be smaller. Why? Because the providers that are in that network do not get paid as much for services rendered to their patients. Okay, but the reason they do it is because they get more patients. So it's more of kind of a quantity kind of a situation. And so HMOs are going to have less options. And then a lot of people take HMOs because they usually have a few more extra benefits that are attached to that HMO. And so they're sometimes a little bit more attractive financially, even when there's less choices. A PPO is going to have a lot more choices. Plus on the PPO, you don't have to have a referral to see a specialist. Plus you can go out of the network if you want to. On an HMO, you've got to stay in the network. And here's the point. When we look at these options with Advantage, we're going to have to decide, what do we want to be in, an HMO network or a PPO network? And again, those are going to vary based upon size as well as different restrictions. All right, so those are your choices. Now, within both of these types of Advantage plans, we are going to have certain perks. These are additional benefits that the Advantage company will give to you when you're on an Advantage plan. And so when you make your choices, again, you're looking at these different perks. Almost all of them are going to give you some kind of a dental benefit, usually about $1,000 a year for dental services. Sometimes there's a network, sometimes there's not. They'll throw in a vision benefit. Normally some kind of credit towards eyewear, maybe $150, $200 a year for eyewear plus a routine eye exam. They'll also include many times hearing aids. So they'll put together a network of hearing aid providers, hearing aids that they'll cover. You'll have a reasonable copay, maybe $300 or $500, and they'll pay the rest. They also include what's called an over-the-counter card. So you can go online or through a catalog and order certain over-the-counter items. And they'll normally give you $50 a quarter for that. And so what they're doing is with these Advantage plans, they're throwing these perks in. So when you're making this decision whether which is going to be better, you need to look at those perks. I will tell you this. I'd want to know this. Make sure that you don't buy an Advantage plan just because of the perks. That's not a good decision. Yes, they're attractive, but don't make a decision just based upon that. There's other factors that ought to go into your thinking. All of them will include a gym membership. So you can go to, YMCA or maybe community center or Curves or someplace where they will allow you to go to that facility and you have a free membership if you're part of the Advantage plan. And then some of them, not many of them, but some of the plans actually will reduce your Part B premium. So if they give you $50 a month credit towards your Part B, instead of paying $170.10 a month, your Part B may only cost you $120.10 a month. Sometimes it's a little less, a little bit more, but the average is about $50 a month. Again, so as you compare the Advantage plans, you want to look at these added benefits that are going to be a part of the Advantage system. All right, and so when you make choices, you want to make sure, number one, that your doctors are in network, the hospital is in network, and that you're happy with those copays. So that's how we do the comparison. And then last, I just want to close with this. I want to talk really about kind of some of the challenges that come with both of these systems. What's the kind of the dark side of these systems? Well, frankly, when it comes to supplemental plans, the only dark side is you're going to have to pay a premium for your supplemental plan, and you're going to have to pay a small premium for your drug plan. And on the average, that's going to be somewhere total of maybe $125, $150 a month or so that you have to pay in premium. And so that's an extra $1,800 a year in premium. Now, why do people do that? Well, because they don't want the risk of the gaps. They don't want the issues those financial liabilities. So they're willing to pay a premium to get rid of that risk. But again, that has to fit your budget. And some of you don't want that to fit your budget, or it just simply cannot fit your budget. You just don't have those extra funds on a monthly basis. So that would be the dark side. You're going to have to pay a premium. Now, the positive of that is that you got rid of most of the risk, but for those of you that can't afford that or don't want to afford that, then an Advantage plan is a wonderful option, because instead of paying a premium, what am I going to do? I'm going to pay as I go. And so you're willing to pay as you go. Okay. Now, by the way, there are some insurance plans that we actually can attach to an Advantage called a copay protection plan. So if you're concerned about, maxing out of pocket, you can buy insurance to be able to cover some of that, even on the Advantage side. But the point is that the challenges can be when you get really sick on Advantage plan and you max out of pocket, let's say $600, $700, and then you're still sick the next year and you max out again. And so that's going to happen to some people. But if you hit the max, it can be painful because they reset every January. All right. Now, another issue between these two systems that really can be a challenge to people, sometimes surprising, is that when it comes to Advantage plans, you're going to have pre-authorizations. A pre-authorization is a service that's expensive, and in order for you to have that service, you're going to have that pre-approved by the insurance company. And by the way, you don't have to have a pre-authorization to see your primary care doctor or see a specialist or get lab work or something like that. But I can assure you, if they're going to admit you to the hospital and have a surgery or go to a skilled nursing facility or a CAT scan or an MRI or some kind of outpatient procedure, outpatient surgery, you're going to have to get that pre-approved by the insurance company. So the doctor says you need this service, but it has to be finally approved by the insurance company. And sometimes that can be delayed, and actually sometimes it can be denied. Not always, but it can be. And so people are surprised by that when they enroll into an Advantage plan, they have given the insurance company the final say-so. So again, that's a challenge that people face on that. They have the challenge of a network with some of the restrictions and limitations, but also pre-authorizations. When we get a supplemental plan, again, what's our challenge? We got to pay a premium for that, but we don't have any pre-authorizations. If your doctor says you need the service and Medicare says they'll cover it, it's the end of story. It goes on the calendar. It's going to be done. You're going to get that surgery, that procedure, because the insurance company has no say-so whatsoever. All right. And then lastly, when it comes to the permanency of these plans, most of us want to make this decision. We want to make the right one, and we don't really want to have a lot of hassle. So again, there's a contrast here. If I take an original Medicare and get a supplemental plan, both my A and B and my supplemental plan, that F or G or N or whatever you buy, those plans are written for life. Yeah, the premiums can go up some and will go up, but normally if you go with the right, good, stable company, those are not going to be big issues, okay? And so in those two types of coverage, A and B with my supplemental plan, those are written for life. You'll never lose those. In fact, you can take them with you because it's the same coverage anywhere in the country or even in the territories, U.S. territories. And so you take it with you. If you relocate from, let's say you leave Kansas City, you go to San Francisco, you take the policy with you. You're in Denver, you move to Dallas, take it with you because A and B and supplemental plans are totally portable. You have the same coverage and you just take those plans with you. You would have to get a separate drug plan because you don't take those with you, but they allow you to switch drug plans if you move. All right, now, when it comes to Advantage plans, those are not all over the country. Those are going to be tied to what we call a service area, which is typically a metro area. And so if I move from Kansas City to San Francisco, certainly got to get a different Advantage plan. Denver to Dallas, a different Advantage plan because they're not portable. They're tied rather to an area, okay? And they make provision for you to do that. So it's not a big deal. It just means you got to get a new one after you've relocated. And so they're not portable. And then when we talk about permanency. Advantage plans are not permanent. They're 1 year at a time. It's a contract between Medicare, the insurance company, and you. And so every year you have the opportunity, if you want to switch Advantage plans, you can. There's no underwriting required at all. You can move from Advantage to Advantage, no underwriting, and you just switch companies during open enrollment, which is October 15th through December 7th, or the first 3 months of every year. You can switch those Advantage plans one time, all right, during that year. And so we have this way to change Advantage plans. But the real surprise to people is this, and I'm going to be done after this, and that is when I go on an Advantage plan, and if I stay on that Advantage plan for, let's say, 2, 3, 4, 5 years, and now I want to move to a supplemental plan, in order to make that move, now I have to medically qualify to pick up the supplemental plan. I can buy a supplemental plan when I first go on Medicare, the first 6 months of Medicare, but if after that, if I ever want to move and get off my Advantage now, I have to qualify to get the supplemental plan. So for people that either have health issues when they start Medicare or health issues arise later, if they're on that Advantage plan for, again, more than a year or longer, now they're going to have to medically qualify to get that supplemental plan. And they lost that opportunity to be able to get a supplemental plan with no underwriting. So I'd want to know that, especially those of you that have health issues or there's a possibility of some health issues. You have this window of time when you can buy that supplemental plan. No underwriting, we call that guaranteed issue. Insurance company cannot ask you health questions, and they will not ask you health questions. They have to issue the policy, all right? So again, I would want to know all of those. And then lastly, I do want you to realize that I've shared a lot with you. I understand that. This is a big decision, and you certainly have choices. And so I would want to know who is it that can share all the options with me. And so there's two types of agents out there, folks. There's captive agents that work for one insurance company. They work for Aetna, United Healthcare, Humana, or whoever, one company. Or there's those like us that work for all the companies. We're brokers, independent. And what the independent brokers do is they write for all the carriers, or most of them, and they can show you all those options and compare those plans side by side, talking about rates and rate stability and sharing with you all the different networks and different aspects of the Advantage plan. Why? Because we're not captive to any of the carriers. We write for the majority of them, so our clients get to pick and choose, and we can certainly guide through that process. Okay, and so I just want you to know it'd be our privilege to help you. And if you do one day want to reach out to us, there's a couple ways you can do it. You can go to our website, MedicareSchool.com, and by the way, there's a lot of videos on there that I've done that you can watch and get more details than what I've even shared tonight. But you can go there, MedicareSchool.com, and get educated. You actually can schedule an appointment with one of our Medicare guides. And I want you also to know that I've trained every single one of our guides. I was with a new guide today, all day long training. And so I'm in the office every day as well, helping our agents with cases. We want to make sure that we're guiding you through this process accurately. And so if you reach out to us, or really whoever you're going to use, I can tell you that it's not going to cost you anything to use an agent. The commissions are always paid by the insurance company, not by you. All right, we don't work for free, but we're free to you because, again, the insurance companies will always pay us. And there's no extra money either when you use an agent. You cannot save any money by doing this yourself. Why? Because the insurance company is already built in that commission to pay to the agent. And so what you could do is cost yourself a lot by trying to do this all alone. And we don't want you to make a mistake. And so whatever it is that you would need, if you want us to help you set up your Medicare, A and B, your SSA.gov account, or maybe even start your Social Security at the same time, our guides are trained to do that. We can do that whole process for you so you don't have to do it alone. We'll do it with you and we'll do it for you. Some of you that are high income, I already told you, you're going to have IRMAs. You're going to pay more for your Part B and your Part D plans. And if you have a life-changing event such as retirement, we can help you appeal those IRMAs and change that situation. For those of you that are going to come in Medicare at 65, you're coming in during what's called the initial enrollment period. You need to do that at the right time. We'll make sure that happens. If you're going to come in after 65 and you stay on a group plan, now you have SEP paperwork to do, and we want to make sure that's done. Actually, 2 people show up today in our office, and they did it on their own, and both of them did that paperwork incorrectly. We made those adjustments and submitted to Social Security to make sure it was done correctly. But from A to Z, anything you want us to do, we'll help you and guide you through the process. It will be done right, and it will be done right on time as well. So all those things are important. So whenever you decide to go on Medicare, I hope these things that I've shared with you have been helpful for you. And then keep in mind, invite your friends every Monday at 5 o'clock Central Time, 6 o'clock Eastern Time. We have Medicare Monday. And if you want to leave a comment, in the section below here, put a comment in there. If there's something that you need to know that you would like, that I didn't cover, put that in there, and we'll teach you that in another segment. If you want to follow us or like what we're doing, we'd appreciate that. Subscribe as well, and every time that we do a new video and post something, then you'll be notified about that. But it'll be our privilege to help you in any way that we can. But reach out to someone that really knows what they're doing. I see people make mistakes all the time, and the reason normally is because they get bad advice. They have an agent who really didn't care about them, only the commission, or they just saw something on TV, some kind of ad that they followed, and they got sucked into that program because of what the ad was saying, but the ad didn't tell the whole story. So be cautious. Reach out to someone that can help you. Be our privilege to do so. 800-864-8890, 800-864-8890, or you can go to our website as well. Thanks so much for joining tonight.